Early reports from the UK, Norway and South Africa suggest the Omicron variant may be more transmissible but cause milder symptoms of COVID-19 than prior variants, though a clear picture is still weeks away as researchers around the world race to understand the new strain and if treatments and The observations from Norway and South Africa are both preliminary and from very early days of the Omicron outbreak, and experts caution against jumping to conclusions. More data will be needed and there are many other factors that could possibly account for reports of less severe disease. South Africa, for example, has a relatively young population and a high rate of previous coronavirus infection, both of which could influence disease severity. It is still too early to say whether the clinical picture of the disease is different in Omicron infections than in Delta infections. 3. Major vaccine makers are divided on whether existing shots are still effective against Omicron or whether specialized jabs will be needed. Experts from the World Health Organization say it will be weeks until we can be confident enough to draw any firm conclusions. Manufacturers and government officials say most coronavirus tests in wide use across the U.S. should be able to detect the variant. Early data suggests a previous coronavirus infection offers little protection against reinfection with Omicron, which the WHO designated a variant of concern after researchers in South Africa sounded the alarm over a highly mutated form of virus in late November. Governments around the world moved swiftly to close off travel to southern Africa, something South African officials complained unfairly punished the country for alerting the world to the new variant. Omicron has now been detected in 19 states across the U.S. and a growing number of countries around the world.